the testing data is always lagged. So it takes a few days before people get sick. They then have to decide to take the test. That might take a day or two. And then they have to wait for the result to come back. And those kind of lags mean that when we're looking at testing data today, the results we get today, they're from people in the past and infection rates in the past. So we expect the infection rates to start to fall, but they don't fall immediately that the measures are introduced. And then, of course, the people who are infected now will still be transmitting. We don't make people contact nobody. What we do is to try and reduce the contacts outside of the home. So if people are contacting others within their home, then there will be some onward transmission as well. So we don't expect the infection rates to fall immediately, but we're certainly hoping that they will start to fall very quickly.
Can you give us any sense of when very quickly might be, or when we might reach the peak so they can start to come down?
I would hope that we would start to see the reductions next week. Unfortunately, of course, the people who are going to be going into hospital and who then might die are already infected and were infected potentially before the lockdown. So that means that the admission rates to hospital and the death rates, we might not see those come down for 2 or 3 weeks.
In March, during that lockdown, we saw a fairly quick decline in infection rates. We saw the R rate fall to 0.6 during that first lockdown. Can we expect what happened in March, April last year to repeat itself in January 2021?
So the process is almost identical in the sense that we've had this increasing infection rate. And the sort of measures that are introduced are very similar. I think there are going to be two big differences. One, of course, is we are testing an awful lot more. So we don't really know what happened to the infection rate around the 23rd of March. I mean, there's some evidence to suggest that it started to fall well before that, in the week before. So we might see a delay because of these measures. And I think it's fairly clear from all the data that's coming through in terms of travel and work and schools that the impact of the current measures is not as dramatic as it was in March. And so I think that we are not going to see a reproduction number fall as low as 0.6. Sincere hope that it gets below 1. Because then the epidemic, will start to fall at that point.
And how big a part is the new variant playing in the difficulty in reducing the reinfection rate?
Well, this new variant does look as though it's more transmissible. So that will have an impact as well, but it's only transmissible to the people you contact. So if you don't contact people, then the fact that there's a new variant doesn't make any difference. So it really is about reducing the contact rates, and that's the critical aspect of the measures, is the fact that we reduce the number of people that we could transmit it to if we are infected.
The current lockdown is reportedly different in some areas. For example, head teachers are reporting many more children in school than lockdown 1. Those key workers, essential workers, they're all using public transport. That may have an impact. Do any of those things concern you?
So it is concerning from a disease point of view that there are higher contact rates. On the other hand, I think that there was an awful lot of harm caused by the school closures in March, and we've learned that. And in all these situations, the decision making that the government has to during this epidemic is about balancing those harms. I sincerely hope that there is enough reduction in contact that the reproduction number gets below 1, even with the increased contacts. And of course, we do have better measures now than we did in March in terms of disease control and testing, and if people quarantine and isolate if they're infected or contacts of infection. And we're able to use lateral flow tests or other quick tests in schools, then there is they may well compensate for the fact that there is more contact.
the one thing that we are allowed to do is go to supermarkets. Is that sensible for people to be going to supermarkets?
The problem with supermarkets is that in terms of trying to identify the degree of risk is very difficult because they're very common. Most people have to go and buy their food. And so it's very hard to say, right, well, this group of people are at greater risk because they go shopping and these people aren't. On the other hand, there has been, to my knowledge, no large outbreaks associated with supermarkets.
And how useful are masks in protecting us when we do the essential things like go to a supermarket?
So masks, their main role is to reduce the amount of transmission from you to other people. They may well have some role in protecting people, but it's not very big on its own. It is not a huge prevention measure. But if everybody does it, then it's the kind of thing that can have a significant impact, especially in terms of reducing transmission from somebody to somebody else. So we have about sort of 2% of the population who are infected, so 2 in every 100. So it really is a situation where anything that people do to try and reduce transmission, even if it's small on its own, can have a big impact.
If we meet the Prime Minister's target of vaccinating the top 4 groups by mid-February, that should reduce deaths by 80%, according to some estimates. Can we come out of lockdown at that point?
So there are two, I think, considerations. The first is the time it takes for that vaccination to roll out to reduce deaths. Let's suppose, as a thought experiment, that we were able to vaccinate everybody over the age of 80 tomorrow. Well, it will take at least a week for those people to then develop an immune response. It takes several weeks for them to go to hospital, and then they have to die as well. So there's a time to lag in that. And so what we end up with a situation is that we'll have to wait 5 weeks even to begin to see the impact of vaccination on mortality. Another point is that most of the people who are in hospital are not in the vaccination groups. So the vaccination is being rolled out to reduce mortality, to reduce the amount of death. But the hospitals are going to remain very challenged and very full of COVID patients, even with this current vaccination targeting to the middle of February. They're not going to, the vaccine is not going to have a substantial impact on that hospital burden. And so then we have to wait for the next set of vaccination targets and the next groups of people before we can really think about how we might relax measures then that will allow transmission to go up. So people will still become exposed and infected if they haven't been vaccinated, but they will not end up in hospital or at a much reduced rate.
So once we have met the Prime Minister's target of vaccinating those top 4 groups, then we will still have to wait a number of weeks until we can begin to relax restrictions.
Well, it's a government decision about what they do, but the vaccination program as defined at the moment will have a big impact on mortality, so there'll be fewer deaths. But most of the people who are in hospital are going to recover. But the fact is that they are in hospital, taking up resources that prevent other diseases being treated. So that's still a major problem and still something that has to be addressed.
We all look forward to a time where we can invite our friends and family in our homes. We want to get back to how things were, of course. We know that's incredibly difficult, certainly very, very unwise to do now and illegal to do now. But can we begin to dream at a point, the summer this year, the spring this year, when we might be able to see friends in our homes once more?
Again, that's a government decision about how to balance the harms caused by the disease and the harms caused by the interventions. And the kind of biology of it feeds into thinking that the vaccine is going to have a major impact, that this virus does strongly look as though it's seasonal, like most of the other respiratory viruses, that the winter is the time in which it transmits the best. So as the weather warms up, as we can go outside more, then we expect the virus transmission rates to decrease. And at that point, hopefully, we have widespread vaccination in the population. And so I don't think anyone particularly wants to give specific dates, but certainly as the spring moves through to summer, then I imagine that there will be a big change in the way in which in contact rates and transmission are managed.
Next winter's not going to look anything like the winter we've just had, though, is it? Christmas, the Christmas period is going to be a different, more normal Christmas period to the one that we've just had.
It all depends very much on how the virus behaves. For example, we know that the virus evolves just like everything else does. Everything else biological evolves. And so then if there is a problem either with it evolving to overcome vaccine-induced immunity, or if the vaccine-induced immunity is not permanent, and we need to think about booster doses, then there is a possibility that if this virus is seasonal, then in future winters, we do end up with more outbreaks of this disease, which result in people going to hospital, just as we do with flu every year.
Given that we're now in full lockdown, how concerned are you that the most recent R rate is between 1 and 1.4, which means the virus is still growing?
So the reproduction numbers that are published on Friday are calculated based on data up to the previous Tuesday. And they will not include any impact of the current restrictions in England. And added to which, over the period of Christmas, we've had a big disruption in data streams, and a big disruption in kind of testing and the way that people have behaved in terms of testing. And so there's a more uncertainty associated with these reproduction numbers estimated or published on Friday than there is usually. Added to which, it doesn't include the impact of the most recent measures that have been introduced. So it doesn't particularly concern me at all. We know that the epidemic has been growing up to the 4th of January, and so it's not surprising the reproduction number is bigger than 1. The big question is whether or not the measures introduced on Monday will have the impact to reduce it to below 1.
On Friday, the Mayor of London, Sadiq Khan, declared a major incident as hospitals in London hit critical levels. Is that something we're going to see spread across the country?
So it's quite clear, I think, that the hospitals are struggling to cope with the admissions and the patients that they have in at the moment. Unfortunately, pattern of admissions means that they are going to continue to rise for the next 2 or 3 weeks. So that hospitals are going to be even more challenged in the future. Then hopefully we see a peak in admissions, and then the numbers going to hospital start to fall. But the numbers in hospital are still going to be very high, and it's quite hard to see how the numbers in hospital, when will they get back to the level that they are at now? They're going to go up. When will they get back down? And unfortunately, that's not going to be for several weeks, and maybe not even into February.
Are we ever going to fully be able to say goodbye to all these restrictions? Or put another way, will we ever get rid of coronavirus?
So we will get rid of it as a public health emergency. What you will find, I'm sure, is that at some point during the summer, you will realise that you've gone a whole week without talking about coronavirus, and then a whole month. And then it'll reappear for a period of time and be back as headline news and back in front of everyone's minds. But that period, this epidemic will not end on a day when we can have a COVID-free celebration. It will peter out over a period of time. And my suspicion is that in 5 years' time, we will still have the virus circulating, but we will have vaccines and we will have control measures being put in place locally now and again in terms of care homes or hospitals. But the virus will still be there, and then people will suddenly realise that they're living with the virus that caused this major upheaval to our lives during this year.
When you give advice to the government, whether it's about lockdowns or Christmas mixing or whatever it is, and they don't follow it, how do you feel?
So my role in the kind of providing the scientific advice is really to come up with the evidence. So questions such as, about restrictions at Christmas, for example, then the questions we're asked is, how many households in a bubble should, what is the risk of having bubbles, etc. And we do our best to quantify and answer those questions, and then it's up to the government to take the decision. I don't think that, in terms of the way in which I think about it, we are in any way instructing government to do anything or in any way recommending the government to do things. What we do is to make it as plain as possible, using the best evidence that we can, the implications of different decisions.
It must have been fascinating, frustrating. How would you describe this year for you?
Unusual.